Today let us discuss about thiazolidinedione type of drugs, which are also called as PPAR gamma agonist. These are two types. First of all, let us know what is thiazolidinedione. In oral hypoglycemic drugs, we have known that in second subtype, to overcome insulin resistance, we use biguanides and also thiazolidinedione. In biguanides, we have already discussed about metformin in another class. Now today we will discuss about pioglitazone from thiazolidinedione class. So in thiazolidinedione, there are two types of classifications of drugs. One is pioglitazone drug and the other is rosiglitazone. In the rosiglitazone produces myocardial infarction as side effect, so it was banned. And pioglitazone also causes carcinoma of urinary bladder, so it was banned before but now in use with warning. The mechanism of pioglitazone. The pioglitazone is selective agonist for PPAR gamma. What is PPAR gamma? It is the nuclear peroxisome proliferator activated receptor gamma. This one is expressed in fat cells, muscle cells and some other type of cells. What is the mechanism of action of pioglitazone? It is the selective agonist of PPAR gamma, which is expressed in fat cells, muscle cells and some other type of cells. So by this expression, it increases the transcription of several insulin responsive genes, so that it reverses the insulin resistance by increased expression of GLUT4. GLUT4 is the receptor which increases the absorption of glucose into the cells, and also translocation. What does it do? It increases the transcription of several insulin genes so that it reverses the insulin resistance by increasing absorption of glucose by increasing the expression of GLUT4 and translocation. And the other action is it increases the entry of glucose into muscle and fat tissue. And the other action is increases the peripheral insulin sensitivity, and also it decreases the hepatic gluconeogenesis. It decreases the lipolysis and decrease plasma fatty acid level, and also it decreases the triglyceride levels and increase the HDL cholesterol level. Let's summarize this. The mechanism of action of pioglitazone is the selective agonist for PPAR gamma expressed in fat cells, muscle cells and some other, so that it increases the transcription of several insulin responsive genes which reverses the insulin resistance by absorption of glucose and translocation. Increase the entry of glucose into muscle and fat tissue. It also increases the peripheral insulin sensitivity, decrease gluconeogenesis, decrease lipolysis and decrease plasma fatty acid levels and triglyceride levels, but increase the HDL cholesterol. It was good cholesterol. So we have to remember all these. These all type of actions combinedly will decrease the glucose in blood, so that we cured the diabetes mellitus. Pharmacokinetics. Metabolized by both cytochrome 2C8 and cytochrome 3A4 type of enzymes. These are cytochrome P450 enzyme types. The pioglitazone drug is metabolized by these type of drugs, by these type of enzymes. Uses: in type 2 diabetes mellitus, we use pioglitazone. It decreases the blood glucose and HbA1c without increasing insulin levels. In mechanism of action, we see that it only decreases the glucose levels, but it does not increase the insulin level. So the other action is it conserves beta cell function. And the other one thing we have to discuss here is The pioglitazone action, for a pioglitazone action also we need some amount of insulin in our body. In type 1 diabetes mellitus um, it is not used. The adverse effects of a pioglitazone is plasma volume expansion, so that edema will occur, so that weight gain will occur. We have headache, myalgia, mild anemia, CHF, risk of fractures also. Mm, and then failure of oral contraception while we are taking this pioglitazone. If with pioglitazone we take some oral contraception pills, that oral contraception activity will be decreased by pioglitazone, so failure will occur. Hepatic dysfunction, and as we see here, no hypoglycemia here. uh, Contraindications: liver failure, pregnancy, CHF. Interactions: ketoconazole decreases its metabolism and rifampin increases its metabolism. If it increases the metabolism, the pioglitazone levels will be decreased in our body. If it inhibit the metabolism, the pioglitazone levels will be increased in our body, so its toxicity occurs. So these side effects will be enhanced by that. Let's summarize again the side effects of pioglitazone: plasma volume expansion, edema, weight gain, headache, myalgia, mild anemia, CHF, risk of fractures, oral contraception failure, hepatic dysfunction. As we know that oral no hypoglycemia like sulfonylureas, in that case they produce hypoglycemia. Here we don't see hypoglycemia. And interactions, or ketoconazole inhibit metabolism and rifampin increases its metabolism. Contraindications or liver failure, so that so we have seen here hepatic dysfunction is occurring, so we should avoid this drug in liver failure and also pregnancy and congestive heart failure.